Okay, namaste all. So we move on to the next disease in our series, which is Vatarakta. So we saw the mention of this disease in our previous lecture in Amavata. So we'll discuss that in detail now. Disease caused by disturbance of Vata and Rakta both separately. Hence, it is called as Vatarakta. So then, as the name says, Vata and Rakta, involvement of Vata and Rakta, both these vitiated entities cause the disease, Vata Rakta. Sushruta has explained this condition. So I'm sure by now you know the rishis, the acharyas who have written various classical textbooks. So few names I'm sure you must be familiar with: Charaka, Sushruta, Vagbhata, Madhav Nidanvi, Madhav, we saw in the previous disease. So here is Sushruta, who is the the surgeon in Ayurveda, who is known for surgery. So who uh, deals with majorly the diseases and the surgical part of it. Okay, it's not that he has not described medicine, but his approach towards treating a disease more has been towards the surgical procedures. So we can find the description of Vatarakta in Sushruta. Okay, Rakta gets disturbed due to Vata Avaran and further disturbs Rakta, making it a strong disease. Further disturbs Vata. Uh, Sorry, the Rakta which is disturbed, which will um which will get disturbed due to avarana of vata. Okay, so what happens exactly is vata is aggravated, it will create a avarana. Avarana is a cover or a envelope, we can say a capsule. Okay, so vata encapsulates rakta, the vitiated rakta, and it will further vitiate rakta because of its avarana, because of the um, envelopment or the um, encapsulation of vata. So in this condition, both vata and rakta get disturbed on their own due to causative factors causing their individual disturbances. Okay, so the hetus which vitiate vata, those are followed. The hetus, the causative factors which vitiate Rakta Dhatu, those are followed, and their individual vitiation happens, and then they come together, and this disease, Vata Rakta, gets formed. So, Vata Rakta is vitiated, and the vitiated Vata will create a avarana or capsule envelope uh, to uh, around the Rakta, vitiated Rakta Dhatu. Difficult to treat and very painful. Okay, so as we move to the treatment part, we'll understand more of this. It is painful. So many diseases in which there is involvement of joints, it becomes painful just because joint is, for any movement you need joint. So wherever there is involvement of joint in any disease, the pain factor, the pain element is naturally more. This is a Madhyama Marga disease. So there are margas, three margas in through which marga is uh, the road. Marga, basically the literal meaning of marga is road. So uh, this is a disease which falls in the pathway of madhyama. So there are three pathways, such pathways. Abhyantara, Bahya, and Madhyama. Okay, so I should say Bahya, Madhyama, and Abhyantara from outward inside. Bahya is external, Madhyama is middle, and Abhyantar is internal. So there are three pathways of routes of the diseases, okay, in which the disease formation happens. So if you have learnt it, you would know. If you have not, you would learn this in the future lecture. So this is a disease of Madhyama Marga. I'll just repeat: Bahya, Madhyama, and Abhyantara. External, middle, and internal. Okay, these are the pathways of the diseases. So this falls in the Madhyama Marga. Vatarakta. So what are the types of Vatarakta? Vataja, Vatarakta, wherein Vata is dominant. Pitta Anubandhi will be there. Kapha Anubandhi will be there. Rakta Anubandhi, dominant force Rakta would be there. Two dosha dominant, three dosha dominant. Dosha dominant is Dvandvaja. Three dosha is Sannipata. Okay, we know this. Dvandvaja, Sannipataja. And Charak has stated two other conditions apart from these: superficial and deep seated. Okay, so we will learn this in the next slide. So Vataja, Pittaja, Kafaja, Raktaja, Dvandvaja, Sannipataja, and two separate ones, Uttana and Gambhira, superficial and deep seated, which are mentioned by Acharya Charak separately. So Vata causative factors: delicate constitution, Pitta constitution, obese patients, people used to a luxurious lifestyle and sedentary lifestyle following the causative factors will cause Rakta Dushti. So here, delicate constitution, majorly it is Pitta body type. So Pitta Prakriti, body constitution is Prakriti. Pitta Prakriti patients or people who have Pitta Prakriti are Sukumar, delicate. Sukumara is delicate in what sense? They would not be able to bear a lot of heat, external heat, or not too spicy, not much of physical activity. I mean, strenuous physical work. They would do physical work, but not on a larger quantity. Then their pitta will get disturbed due to small amount of apatya also soon. So that is Sukumarata. Okay, Sukumarata. Pitta constitution. In Pitta constitution, Rakta issues or diseases in which Rakta vitiation happens, the probability of having Pitta diseases and Rakta diseases is more. Okay, they are more vulnerable, we can say. Obese patients, heavyweight patients, people who are used to luxurious life is not much of physical strenuous activity. So physical activity is less and uh, a sedentary lifestyle. So the people sedentary lifestyle. Oh, I'm sorry. Yeah. So these are the things which will cause Rakta Dushti. What are they? Consuming salty food, lavana, sour, amla, pungent, katu, anchas, snigdha, hot, ushna foods. Okay, so these will cause Rakta Dushti. Eating when suffering from indigestion. So Adhyashana. This we saw in the previous diseases also. Adhyashana, when the previous food is not yet digested, but the next food is consumed. That is called as Adhi Ashana. Fermented foods. which cause vitiation of pitta and rakta both. So in this case, rakta, we are considering rakta doshti. Eating meats of animals living near or in water. So Anupadesh Anupamansa is the Sanskrit term. So meats of animals who live in the water or near the water will cause rakta doshti. Sesame and sesame seeds or sesame products. So pinyaka, sesame oil. And this we saw sesame paste, basically sesame seed paste, which is what we saw in Amla Pitta, if you remember. So those will cause Rakta Dushti. So all these products or food items will cause Rakta Dushti when consumed in excess amounts and too frequently. Radish, black gram, yogurt, alcohol will will vitiate Rakta Dhatu. Viruddha Ahara, incompatible foods. Adhyashana, eating food without before the digestion of the previous one. Sleeping during daytime and being awake in the night or sleeping late in the nights will increase vata and also cause rakta dushti. But in this case, we are considering vata vitiation. Anger will vitiate pitta and rakta both. Along with uh, along with this, trauma, excess walking, running, exercise, bitter, pungent, astringent food. So trauma, excess of walking, running, exercise. So excess physical activity is going to aggravate vata dosha. We know that. Bitter, pungent, astringent is going to aggravate vata dosha. Dry foods, ruksha foods, yes, that causes aggravation of vata. Excess indulgence in sex, physical activity, and suppression of natural urges causes vata prakopa. Now here, just to add, we discussed in this in the previous one of the previous diseases also, that when we say vega dharan, okay, veg dharan is suppression of natural urges. Vega udiran also will cause vitiation of the dosha. Okay, what is vega udiran? Which means forceful, uh, forcing away uh, the natural urge. For example, I am not feeling hungry, but I eat. That is going to be Vega Udiran or Kshuddha Vega Udiran, forceful eating, forceful drinking of water, forceful vomiting, forceful passing of stool, forceful passing of urine. These are natural urges, but they are forced. So those also will cause the vitiation of uh, the doshas. In this case, Vata Prakopa will be there. Okay, so not only holding the natural urges creates problem, but forceful passing of those also or provoking those also will cause problems. But uh, when in the patients, when we see majorly what is the more probability, it is suppression of the natural urges. Okay, suppression happens more than the forceful provoking. So but we also have to understand and know the other aspect, okay, of natural urges. So forceful provoking of the natural urges should also not be done. Sitting with legs suspended also an important cause. Okay, legs suspended is sitting in a chair for long time. Okay, and in hanging state more so. This will cause the blood to stay in that place for more time, and the blood flow will be uh, it will not have happen properly when the legs are suspended for too long. Okay, so you will see collection of, I won't say blood, but more of oozes in the leg. So the fluid will come in the interstitial space, when the legs are hanging for too long. Hence, whenever we see patients who have sedentary lifestyle or who sit in the office for long time, or they have to keep their legs, feet suspended for long time, then for them we tell the patients to keep have a leg raise rest. Leg raise rest is they are lying in the bed and with their legs raised above their heart. Okay, so one or two pillows below the leg will suffice. So the blood, whatever mm, fluid which has accumulated, or whatever blood which has not passed properly, will come into proper flow. Okay, so if at all there is some edema or swelling which has happened, that will also help in reducing that. Okay, so people who have sedentary lifestyle, for them two things should be told properly. One is leg raise. Okay, resting for 5 minutes twice a day also will help. And second, walking. It will also improve the pumping uh, of the heart. Okay, so pumping of this heart also, and of the so there is a system in the calf. Okay, calf muscles, wherein when they uh, come in motion, when they are in activity, that time they will help in pumping the blood from below upwards. Okay, so that is called as uh, peripheral heart. Peripheral heart, okay, of the body. So when they pump, when they are in action, they will help in taking the blood which is gathered in the lower extremities upwards. So it will help this heart, okay, in the proper circulation of the blood. So hence walking also will help. So patients who have sedentary lifestyle, as I said, should be advised two things: leg raise and walking. Minimum 15 to 30 minutes is quite good to take care of the clogging or swelling in the legs. So if that thing happens, then any disease which may be happening in future related, so it can be vata rakta also. It can be, say, varicose veins, for example. If you have heard of varicose veins, so varicose veins also happen because of that. People who have long standing jobs, so not only sitting but standing, if they are not moving from one place to the other for a continuous long time, for with them also this thing about uh, collection of fluid in the lower extremity or in the legs is going to happen. For them also two things: walking and leg raise. Okay. Vata Rakta. So Samprapti, what is the process of disease formation? Causative factors
Sorry,
causing Vata
could I just ask a question?
Yes.
With varicose veins, would that actually reverse it? Those
Sorry,
two with
can you
varicose
repeat?
with varicose veins, would that
Huh?
actually those 2 points that you suggested, would that actually reverse it, or it would
It will help in reversing.
help in reversing?
Yeah, it will help in reversing if it is early stage.
Yep. Okay.
Okay, if it is bleeding stage, then it will only help in keeping it in control. Nothing beyond that. Okay, in early stages, in fact, it will prevent. If you ask the patient to do these two things, it will prevent. And if your question is related to if somebody has varicose veins, if we suggest these two things, will it reverse? If it is early stage, it will help in reversing. If it is advanced stage, it will not really uh, cure, but it will help in healing. Okay, with whatever other medicines you are giving. Okay.
Okay. Thank you.
So causative factors causing vata disturbance, along with specific causes like traveling, sitting in legs suspended position. So vata disturbances along with uh, So we saw the internal factors, which food items which can cause vata aggravation, and the external factors like traveling or sitting with legs suspended for a longer time will be the first step of the samprapti. Rakta disturbing factors will cause Rakta Prakopa. So Vata Prakopa has happened, Rakta aggravation both have happened. The disturbed Rakta and Vata start circulating, moving throughout the body. Okay, so both have the tendency of flowing all over the body. Vata is aggravated, so it will keep moving, and Rakta naturally has to move, and it is further vitiated also. So vitiated Vata and Rakta, which keep moving in the body, will look for sthana vaigunya. Kha vaigunya, process of disease formation, you must have learned kha vaigunya. So these weak points, kha vaigunya basically is weak points in the body where the dosha will see um, a favorable place to stay. When they find a favorable place to stay, they will go and stay. Localization will happen. Sthana samshray, we saw in the previous disease. Sthana samshray will happen. So this vitiated rakta and vitiated vata will go and get localized in uh, smaller joints. In this case, in vata rakta, it will happen in smaller joints due to vyadhi prabhav. So prabhav is basically the unexplained nature of a particular process. So in this particular case, Vatarak, so we cannot really explain why this happens in only smaller joints. But when it is, we cannot really explain, then we have to consider it affinity of those doshas towards those smaller joints due to the prabhav of the vyadhi, of the disease. Okay, so it has a affinity towards the smaller joints, and they get localized there. The sthana samshraya happens in the smaller joints, especially these smaller joints. It starts mostly with the feet, and in that also uh, the smaller joints of the toes. Okay, greater toe is seen getting affected first. Okay, the greater toe, and cause vata rakta. So visheshan of rakta, visheshan of vata happens. They move in the body throughout, and they because of the affinity or prabhav of this disease, they get localized in smaller joints, and they cause this disease called as vata rakta. Okay, what are the premonitory signs? Excess sweating, complete lack of sweating. So it can be excess sweating also, it can be no sweating also. Okay, so either of these can be seen. Skin tone, dark or pigmented. The skin tone will deteriorate, it will turn dark uh, into complexion, or it will look pigmented or tanned also. It will have a tanned look, but uh, it will not be really due to exposure to sunlight. Loss of sense of touch. So the at that point where the localization of the dosha has happened, loss of sense of touch can also be one of the signs. Excess pain, even with small injury or trauma. So wherever the doshas have got localized, so if there is a trauma there, then there can be severe pain in that joint. Looseness of joints. So looseness, this is how do we say, opposite of what we saw in Amavata, where we saw contracture of joints. Here, looseness of joints. So hold of the joint, it reduces. Lethargy is seen. Eruptions on the body. Eruptions are basically small pimples, you can say, or boils or abscesses on a smaller scale, which can happen on the knee, the legs, thighs, pelvic region, hands, feet, any of those. Okay, so small eruptions like pimples also can be seen. Severe pain, heaviness, loss of sensation, abnormality of the joint, sandhi vikruti. So, pain due to vata, heaviness due to presence of ama also will be there, and because of the looseness of the joint also the patient will feel heaviness, or he or she is not able to move the joint properly, hence that heaviness can be there. Loss of sensation, a loss of sensation of touch, abnormality of the joints. So abnormality is not able to move the joint properly, so that will be termed as abnormality of the joint. Sandhi vikruti, that is the Sanskrit term, abnormality of the joint. So in terms of movement of the joint, that will be sandhi vikruti. Hives on the skin, if you understand hives, so that is called as mandalotpatti. Okay, so kind of rashes on the skin will happen, which will be red in color, which will be itching. There will be itching also, but redness and burning sensation will be there. So hives on skin will be one of the purva rupa of vata rakta. Signs and symptoms. Purva rupa in exaggerated or full formed version of purva rupa will be seen. Apart from this, excess pain in the joint, vikruti spreading from smaller joints to larger joints. So as the uh, the vitiated vata and rakta get uh, localized in the smaller joints, they will also get so as the disease progresses, they will affect the larger joints also. Okay, and vikruti spreading from smaller joints to the larger joints. Edema, swelling will be seen on the affected part. Redness will be seen. So this redness will be due to rakta, visheshan of rakta dhatu. Inflammation, tenderness. So the patient will not really allow you to touch uh, the affected part, or with small touch also the pain will aggravate. So that is tenderness. Fever, rakta dhatu visheshan can cause fever as well. Okay, jwara. So two other types in vata rakta which have been mentioned by Charaka Acharya. Uttana, which is superficial, and Gambhira, which is deep seated. So the how do you understand if it is Uttana or Gambhir? So Uttana, superficial, is involvement of skin and Mamsa Dhatu. Okay, skin and Mamsa Dhatu will be involved. What are the signs and symptoms which will be seen? Itching, burning, pain, pigmentation of the skin, or change in complexion of the skin will be seen, and which will indicate that this is a superficial or Uttana Vata Rakta type. And in Gambhira or deep seated, Meda Dhatu, Asti Dhatu, and Majja Dhatu will be involved. Okay, Meda, Asti, and Majja. You see, skin, which is related to Rasa Dhatu. Okay, Rasa Dhatu and Rakta also, of course, but Rakta is anyway vitiated here. So Rasavaha, Rasa Dhatu, and Mamsa Dhatu will be involved in superficial, and as it goes, if it is deeper or deep seated gambhira, then Meda, Asti, and Majja will be involved in the disease. So what are the signs and symptoms which will be seen? Edema, hardness, okay, so hardness of the affected part, severe pain, inflammation, loss of sensation, and sandhi vikruti. Okay, so sandhi vikruti is abnormality of the joint. So when the intensity of pain is more, then there is a chance that it is a gambhira type of or deep-seated type of vata rakta. So this is just an explanation which we find in Charaka classical textbook, Charaka Samhita. Okay, Uttana and Gambhira. Complications or upadrava of vata rakta. Insomnia. Okay, Nidra Nash is the Sanskrit word. Aruchi, impaired perception of taste. Shwasa, breathlessness. It will start with breathlessness and it will then finally end up in shwasa or asthma. Mamsakotha. Mamsakotha is decaying of Mamsadhatu. Okay, decaying of Mamsadhatu will be one of the complications. Severe headache, fainting, murcha, hallucinations. Hallucinations is seeing or experiencing something which is not present there. Okay, so mind involvement also will be there at a complicated or complex stage of the disease. Whole body pain. So pain will not remain localized, it will move to the other parts of the body also. So the patient will feel the whole body is paining. Thirst, fever, tremors. Tremors is shaking. Shaking of the joints, the extremities. Hiccups, herpes. So rakta, as it vitiates more, fever, thirst, herpes zoster or visarpa is one of the diseases which we will be learning in the further lectures. So herpes can happen. Skin diseases, of course, as rakta dhatu is involved, skin diseases will be one of the complications. Disfiguring of the joints, so sandhi vikruti, we saw. So as the disease progresses or stays in the body for longer time, the shape of the joint will change. Okay, so it will look different. You will see the affected part looking different than the other normal joints. Heart conditions, heart diseases or rudrog will be one of the complications. So involvement of heart will be there as a complication in the diseases because of presence of rasavaha, raktavaha, rasa and rakta dhatus. Okay, so wherever rakta and rasa are vitiated, you will see heart conditions as a complication or upadrava. Okay. Prognosis. So one dosha or new early stage, it is easy to treat. Two doshas with few complications controlled by treatment. So when there is more than one dosha, then becomes difficult to treat and it will give relief till the treatment is on. So it can be controlled by treatment. Sannipatic with lot of complications, asadhya, untreatable. Chronic for more than a year, managed by treatment. Okay, so when it becomes old or chronic and it has got involved, it is involving complications also. It can be managed with treatment, curing will be difficult. Okay, so till the time medicines are on, it will be okay. cannot reverse the disease. Chikitsa. Shodhana is important. Snehana, Svedana, followed by Virechana. So Virechana is a good treatment for Rakta Dhatu. Hence, Snehana should be done first, Svedana followed by Virechana. Basti or enemas, Niruha and Anuvasan Basti should be given alternately. Niruha and Anuvasan should be given alternately. So here, Basti is a treatment good for Vata dosha. We know that it is a good treatment for Vata dosha. So Anuvasan and Niruha. So Niruha basically will it will evacuate or expel out the doshas. And so in doshas, Mala also will be there and Vata will also be there. So it will expel out the doshas, and Anuvasan Basti will alleviate the Vata. Okay, it will pacify the Vata. Okay. Whilst undertaking Shodhana, due care taken that no further inflammation is caused by Abhyanga, Svedana, and diet. So, whilst Shodhana is happening, Shodhana can aggravate the Vata if it is happening more. If you remember in one of the diseases we saw, Karsha, we saw that in Karsha, that if the Shodhana has happened in excess, Dhatu Kshaya will happen and aggravation of Vata will happen. So Shodhana, when it is done, it should be done in a proper controlled way. Medicines have to be given in such a way that Shodhana will happen uh, to the required extent, and Dhatu Kshaya, Janya Vata Prakop. So Dhatu Kshaya, and because of that aggravation of Vata should not happen. So when the aggravation happens, it will aggravate inflammation, pain, all those things can certainly happen. So the line of treatment has to be designed in a proper way, is what I'm trying to say. Rakta Mokshana also is useful. Rakta Mokshana is basically done in 3-4 ways. So one is leech therapy. Leech is applied to the affected part, and the blood is sucked by the leech. So Rakta Mokshana basically is a treatment which is very good for Rakta Dhatu. Okay, Rakta and Pitta both, but majorly Rakta Dhatu, wherein localized vitiated Rakta Dhatu is present, and impure blood or vitiated Rakta is expected to be removed. So in that, leech therapy is one way of bloodletting. Second is Siraved or venesection. So vein is punctured with a fine uh, blade, and the impure blood is let out. That is Siraved venesection. And then Alabu Karma, cupping therapy, etc., are also followed. So various people who develop skill, accordingly they use that. Few people only use leeches, so they do not do venesection. And there are Vaidyas who, according to the disease, decide what is the amount or quantity of blood which should be expelled out or should be removed or should be let out. They decide which form or way of bloodletting should be used. Now, if suppose there is a problem in this region and you want to suck the impure blood or expel out the impure blood, then in that case, better which will work is the leech therapy, because it will remove the impure blood which is localized here. Okay, when you do venesection or vein is cut, it is supposed or expected to uh, remove the impurities in the sarvadehik blood. So the blood which is present in the whole body, the impurities will come out from that vein. That is what is expected. For localized, majorly leech therapy is done, which does not really take out the impurities or vitiated rakta from the whole body. It will take out impure blood from the localized area. Okay, so depending on what is the expected outcome which you desire, based on that, the bloodletting should be done. Now, again, the question may arise: we are not allowed, or you're not allowed to do it in Australia, etc. What? But because this is mentioned in the classical texts, hence we have to understand it. According to the medicines, when we learn in the future lectures, we can understand how a particular disease should be approached. Okay, so Rakta Mokshana is helpful. It will reduce the it will remove the localized vitiated Rakta Dhatu. Also, it will reduce, because the Rakta Dhatu has come out, it will reduce the inflammation, it will reduce the redness and the pain also to an extent. Okay.
Just one question.
Yeah.
Doreen?
If you do the then function, how do you, when do you know it's the impure blood is out and that you have to stop? What's the signs of the blood?
Okay. See, when Rakta Mokshana is done through Siraved or venesection, that time we saw this in Rakta Pitta also. Okay, we discussed about it. That when the blood initially, the blood comes, impure blood comes out. Okay, so the color of that is not natural red. It will be blackish. So according to doshas, it will be various colors. So it will not be natural color. So you can see dark color blood coming out, or it will be frothy. So impure blood. So there are signs of impure blood coming out. Okay, and when that stops and pure blood starts coming in, you will see the color of the blood changes, and then you will understand and realize that okay, now pure blood has started coming out. So that time the blood should be stopped from coming out. Whatever has come out will be impure blood. Now when you do leech therapy, the leech is believed to suck only impure blood. So when the localized impure blood is completely removed, it will fall off automatically. Okay, and whatever it has sucked, it will only be impure blood. Okay, so when you see uh, the leech is made to vomit the blood, the color of that blood, and match it with the color of the fresh blood which is coming out from the puncture made by the leech, you will see a difference. So we see that difference, we understand, okay, this is a different color or dark color blood or impure blood, and the one which is coming out is a fresh colored or a better red color, more red color blood. So the color of it will indicate that the impurities are completely out. So that alertness will be there during venesection. That alertness will be required when venesection is done. Okay, so with experience you will understand that okay, impure blood is finished now, fresh blood has started coming out. The color difference you will start realizing as you see more cases physically. Okay, and uh, you need not really worry when a leech is applied, because the leech is expected, it is believed that it will remove only impure blood. So even if 5, 6, 7 leeches are applied in a localized area, they will only suck impure blood and they will fall off. Okay, so in that case, you don't have to be alert to decide whether pure blood has come out or impure blood has come out. Okay, so medicinal leeches basically are used. Medicinal leeches are used. So the breeding of that is done in a lab, you can say, and then they are sent to various vaidyas. To answer your question in one sentence, with experience you will understand the difference between pure and impure blood, okay, as you see more cases. Okay, Dore, if
Thank you.
okay. So Shamana, Lepa, Abhyanga, Parisheka, Upanaha. So all these are separate procedures. Lepa basically is application of pack. Okay, so herbal, medicinal pastes are applied as lepa in the on the affected area. Abhyanga, application of oil or ghee, medicated oil or ghee. Parisheka is basically, if you have heard of Shirodhara, so pouring of medicated oil or ghee on the affected part will be parisheka. So if suppose this particular joint is affected, so what is this? There is a bowl which is carrying this medicated oil or ghee and is poured on the affected part. Okay, so that is called as parisheka. Okay, so because the oil or the medicated ghee, whatever is used, is warm also. So the warmth of that and the actives in the medicated oil or ghee will help in reducing the vata, the elevating the vata and reducing the pain. Upanaha is hot lepa. Okay, so hot paste is applied on the affected part and it is covered, okay, with a cloth. So that is called as Upanaha Sweda. So Upanaha basically is a form of Sweda, but because it is done with medicated or herbal paste, it will have lepa and Swedana properties of both. Okay, Upanaha. Lepa can be of sesame paste, shatavari roots, castor seeds, haridra, dashangalepa, sandalwood. So all these can be used individually as lepa in Vata Rakta. So they will have Vata elevating and Rakta elevating properties also. So elevating Rakta is purification of the Rakta Dhatu will also be a part of their action. Abhyanga, Shatavari, Yashtimadu, Guduchi, Bala, Bala Tela, Shira Bala Tela, Chandan Bala Lakshadi Tela, Guduchi Tela. So Abhyanga can be done with Shatavari Tel, Yashtimadu, Gruta or Tela, Guduchi, Yashtimadu, Guduchi, Bala, their combination also can be used in oil form, Gruta form also. Bala Tela is good for elevating Vata. Kshirabala is good for. So these oils are basically which will alleviate Vata and it will help in elevating the Ushna Tikshna gunas of Rakta also. Not Tikshna, Ushna guna. Rakta. Parisheka, as I told, pouring of medicated Vata pacifying substances in the form of Quatha. Yeah, Quatha also can be used. Okay, decoction. So decoction of herbs which will alleviate Vata and also alleviate the Ushna Guna of Rakta. Upanaha Vata pacifying herbs. So Vata pacifying herbs made it into a paste combination, and the warm paste is applied on the affected part, and then it is covered. That is Upanaha. So what are the herbs which can be internally given? Guduchi, Manjishta, Sariva, Kumari. Kumari is aloe vera. Nimba is neem. Shatavari, asparagus. Dashamula, we saw this combination. Eranda, castor. Triphala. So Eranda, apart from its oil form, powder form also is used in the treatment. Okay, so Eranda Mula, the root of Eranda also is used in the treatment in powder form. Triphala, we know Bibhitaki, Haritaki, and Amalaki. Combination of that is called as Triphala, 3 fruits. So all these herbs are vata pacifying and helps in purification of rakta dhatu. Okay, so it will pacify rakta and also help in prakrut formation of rakta, prakrut natural formation of rakta. Amrutadi gugul, guduchi sattva, guduchi kwatha, amrutarishta, amrutadi gruta. So Amrutadi Gugul main ingredient is Amruta, which is Guduchi. Guduchi Sattva is the root extract of the root in the dried form. Okay, root extract in the dried form. It is Guduchi Sattva. Guduchi Kwatha, decoction of Guduchi. Amruta Rishta, that is self-generated fermented form of the medicine in which Amruta or Guduchi is one of the main ingredients. Amrutadi Kruta, okay, ghee medicated with Amruta and Adi. Adi is etc. So additional herbs are also there which are Vata pacifying and Rakta purifying. So Amruta basically Guduchi is one of the potent herbs in Vata Rakta. So uh, the herb Guduchi, it will not only pacify Vata, but it will also help in the proper formation of Rakta. So Prakrut formation of Rakta because of its Tikta Rasa, Ushnavirya, it has a very good effect on Vata Rakta disease. So you will see Guduchi is used in various forms. You see Gugul, you see Sattva, you see decoction, you see self-generated alcohol liquid, you see gruta, ghee, medicated ghee. In dry form also, Guduchi is used in the treatment of Vata Rakta. As Rasayana, Sanchamani Vati, Guduchi Siddha Gruta. Again, here you see, as a Rasayan, Rasayan will be basically given when the disease is treated, okay, and it is completely treated. Now we need to give strength to the dhatus. That time Sanchamani Vati. Sanchamani Vati, the main ingredient is Guduchi Ghana in Sanchamani Vati. Okay, Guduchi Ghana. Ghana is the decoction which is continued to heat, cook, and then finally a paste, a thin paste would remain. That is that paste is then made into small tablets. So that is the ghana of Guduchi. Sanchamani Vati, then Guduchi Siddha Gruta. And so ghee, which is Siddha or medicated with Guduchi, that also helps as a Rasayana in Vata Rakta. So Rasayana, Vata, wherever Vata diseases are there, Rasayana will help in igniting the digestive fires of particular doshas. Dhatus. Okay, Rasayana will have action on the dhatu Agni of the dhatu. So, in the process of disease formation, wherever there is impairment of uh, the Agni and also vitiation of Vata, and when it becomes chronic, there will be the deterioration, kshaya of the dhatus, and there the rasayana will uh, be expected to be given every time. So whenever you find a chronic patient with a disease or a dhatu kshay has happened, that time your shamana chikitsa, along with shamana chikitsa, after a few days when the symptoms have pacified down, subsided, that time Rasayana Chikitsa can simultaneously help in giving nourishment to the dhatus. Okay. So what is Pathya Apathya in Vatarakta? Old rice. So we know that what is old rice? Wheat, moong, amalaki. Moong is moong dal. Amalaki, gooseberry, cow's milk, ghee. All these are Pathya. So these will ensure that Vata pacifies down, and it will also alleviate the Rakta and help in improving the quality of formation of Prakrut Rakta. Okay. So cow's milk, ghee, you will see certain things which are Pitta pacifying. Okay. Because of Rakta vitiation, Pitta vitiation also can happen. But the uh, the food items which are given, they are given with an intention of pacifying Rakta Dhatu. Okay. Apathya, black gram, salts, meat of waterborne animals. So animals which are close to the water bodies, Anupamansa, that is called as. So meat of waterborne animals or animals living in swampy areas should be apathya. Pungent taste foods, Ushnavirya foods, Lavana foods will be aggravating or vitiating the Rakta Dhatu. Daytime sleep will also cause vitiation of Rakta Dhatu. Exposure to heat and exercise. So exposure to heat uh, is a causative factor for vitiation of Pitta and Rakta both. Okay, so in this case we are relating it to the Rakta Dhatu. But patients with exposure to excessive heat, so people who work in the forging industries where they are exposed to continuous and more heat, they have a tendency of getting diseases of Pitta and Rakta Dhatu. Okay, so vitiation of Rakta Dhatu and vitiation of Pitta will happen more in people who have exposure to heat. So forging industry is one, people who work in the fields. It's okay. So in fields, they may be working in farm, or they may be having uh, uh, their form of work in which they have to travel in hot sun, or travel from one place to the other, and then they get exposed to heat. They will also have uh, they will have more tendency of having pitta diseases and rakta diseases. So people with amla pitta or people with rakta pitta, people with visarpa herpes, people with vata rakta, you will find the common element here either will be Rakta or Pitta, vitiation of Rakta or Pitta. So people who have more exposure to heat in the form of sunlight or in the form of heat of the machinery or fire, they will have a tendency of developing any of the problems related to Rakta or Pitta. So why I'm telling you this is because when you are dealing with patients, not necessary that uh, they will come to you for diseases. So, for example, patients also may come to you saying, okay, what is my body constitution? I would like to understand my body constitution. I would like to understand what is good for me to eat, hitakar, what is not good for me, ahitakar. Same goes with lifestyle also. So, what should I do to prevent diseases and to maintain my health? So, in that case, when you do analysis of their overall being, so their prakriti, their lifestyle, their food habits, their profession, their family history. So when you understand all these factors, then you will be able to define a proper uh, regimen for them in order to maintain their health. And in profession, if you see that certain things of heat exposure or sunlight exposure or exposure to a particular thing, it can be heat, it can be cold also. Okay, so somebody has to work in water, for example, or close to water, or in cold weather, cold areas. If suppose they are working in ice covered areas, then their exposure to cold is going to be more. So in that case, if they are not taking proper care, then they will have a tendency of developing something related to vata. Okay, so what kind of exposure they are getting on a regular basis, based on that, you can define what precaution they should take in order to prevent a disease, or in order to make sure that whatever disease they are going through, it doesn't get aggravated. Okay, so uh, understanding uh, the history of the patient is equally important when you are planning for a for the treatment of that particular uh, of the patient, because nidana parivarjan, we have spoken uh, about it. I have spoken multiple times about nidana parivarjan. Nidana parivarjan is stopping the causative factor. Okay, cessation of the causative factor is the first step of treatment of any disease. And if that causative factor is still being followed, then the problem will be there. Now, just last evening, we had a patient where the patient was complaining of headache. Okay, and uh, we had told certain do's and don'ts to the patient. The patient has a work pattern in which uh, he has to stay outside in open area for his work. And he came yesterday for the follow up, and he said my pain had subsided, but now it is again coming back. The cold weather has recently started, winter has recently started. So since 5-6 days, the cold wave has begun, and he does not take care of, he is not covering his head at all while he is working. So when we ask the leading question of are you using or taking proper care, he said yes, I'm doing everything. So when we asked, do you cover your head, he said yeah, at times I do, at times I don't. And when asked to his uh, family member, she said he does not cover at all. So, patients, as I said in one of the previous lectures, that patients do expect results, but they are expecting results with less efforts. Okay, unless you get really serious in the sense, serious in terms of approach. Uh, Patients, they will seldom take all the precautions in terms of do's and don'ts which you have told to them, because they are relying completely on you and the medicines. I have come to a clinician, I am taking medicines, I will feel better. I should feel better. Even if I don't follow the do's and don'ts, I ideally have to feel better. Is their expectation. But for that, whatever precautions are to be taken, they are not really ready to take those precautions on a regular basis. Okay, so whenever you take follow up of a patient, okay, you've started the treatment, but when the patient comes back with reduced symptoms first, and after a few days of similar medicines being continued, the patient comes back saying the symptoms have aggravated, then these leading questions will become important. Hence, your case taking, whatever you have done, whatever notes you have jotted, again referring back to them and asking leading questions whether you are doing this, you are doing that, following it or not. Because many patients we observe that they take medicines but do not follow uh, cessation of the causative factor. So causative factor, say again an example which we commonly give, you take diabetes medicine and you eat sweet food. What will happen? The end result is going to be zero. The end result is going to be zero because you are taking medicine to reduce the sugar and you are also consuming sugar simultaneously. So what will be the end result? It will be zero. So causative factor, what is the causative factor in this case? Sugar, consumption of sugar. So that should be stopped, and then you keep taking the medicine, then it will show better result. Then it will help in reducing the sugar levels and then going towards the curing stage. Otherwise, if the causative factor is still there, in Vata Rakta, suppose the Rakta Dhatu is getting vitiated on a regular basis, Vata is aggravating on a regular basis, and you are continuing the medicine will give symptomatic relief, but the dosha, the level of dosha is still there. So whenever there is a small gap in the medicine also, say 2 days the patient came late, the symptoms would have aggravated so much. I was feeling better till I was taking medicines. 2 days, the medicines weren't there, and the symptoms or the pain aggravated a lot. In that case, you have to understand, because when you plan for the medicine, you have a certain calculation in the mind. Of course, it doesn't go as a mathematics formula, but you have certain calculation in the mind that so much of the vitiation of dosha has happened, the patient needs so and so medicine. So 10 types of medicines or 5 types of medicines you have formulated for the patient or planned for the patient. And after 1 month of treatment, if the patient says that and the disease is a Sukha Sadhya Vyadhi, okay, Sukha Sadhya Vyadhi, then you know that with less time also and proper treatment, the disease is going to reverse and it is going to cure. But the patient after 1 month of medicine also is saying that medicine finished and immediately the symptoms have aggravated. You have to presume that or understand that the patient is not following the do's and don'ts properly, because 1 month of medicine and no causative factors, the doshas actually have to come down, pacify very fast. Okay, if it is not happening, understand that the causative factors are not being stopped completely. Some or the other causative factor or multiple causative factors are still being followed. Okay, so when causative factors are stopped, medicines are on, pacification of doshas and subsiding uh, signs and symptoms is a natural path of healing. It's a natural path of healing. But if there is something wrong in that, you will certainly understand. So I'm giving you inputs in order to ensure that your treatment is on the right track and your patient also is on the right track. Diagnosis of the disease is your responsibility. Giving proper suggestions on do's and don'ts is your responsibility. Giving proper medicines is your responsibility. What is beyond that? Beyond that, it is the responsibility of the patients to consume the medicines on proper time, follow the do's and don'ts properly, and make sure that the causative factors are not being followed. This is the responsibility of the patient. You cannot be visiting the house of the patient or calling the patient asking, have you taken medicines? Are you following the do's and don'ts, etc. etc. So responsibility lies in your hands as well and on the patient as well. So it has to be a symbiotic relationship. Otherwise, if it is only one-sided effort, it will only give symptomatic relief for a while. After that, the patient will realize that the symptoms are aggravating after the treatment is or the medicines finish. Okay, so all it started from exposure to heat. Wherever you find that there is a specific causative factor or a specific thing which the patient has to repeatedly do and is going to cause vitiation of aggravation of a particular dosha and affect a particular dhatu or affect a particular mala, you have to ensure that if the patient has come in disease stage, then telling them not to follow the causative factor, or if the patient has come only for consultation to understand what is good for them or not, then uh, asking them to take precautions. We cannot really ask the patient to change the job. For example, yes, I mean, some cases we had to tell the patient to change the job because the condition of the patient was not so that he or she could follow that particular job pattern in continuity or in future. But if in many cases you cannot really tell the patient to change the job, so in that case, what kind of precaution can be taken? Apply dinacharya, apply rutucharya, apply your knowledge about the dosha, apply your knowledge about the prakriti. So by that you know what is a particular food item, what is a particular lifestyle which will suit that particular prakriti, will follow, will be suitable for that particular dosha, or if a particular dhatu is going to get affected, what precaution should be taken, or any food item which can be included in their diet regimen, which will work as a medicine also. It will work as a medicine also, and it will prevent any kind of aggravation of dosha or affection of the dhatu or mala. Okay, so simple rules of lifestyle, starting from natural suppression of natural urges or provoking the natural urges, sleeping on time, taking food, so food timings, being connected inside, understanding the signals which come from within. So those small things can be told which have a larger impact on their overall well-being, and if at all they have a problem, then curing that problem. Okay, so your approach when you are dealing with a patient has to be multifaceted. Okay, so uh, understanding their diet, understanding their lifestyle, understanding their profession, understanding their prakriti, understanding their family history, understanding their medical history. Say a particular problem if they come with, suppose somebody comes with joint pain, say shoulder joint again. Okay, so shoulder joint, you start treating the patient as pain in shoulder. Then you realize that, okay, this is not only pain in shoulder, this is going towards frozen shoulder. But if you have not taken a proper history, you won't know that the patient had fallen few days ago and had a minor surgery there, and then the pain started after a while. So medical history is equally important, because certain things will happen as a complication or as a sequel of a particular medical condition which has happened in the past. Okay, so hence we see complications. Why do we understand and why do we study Upadrava? Why do we understand Upadrava? Because a particular Upadrava can arise from a particular medical condition. So hence we should be able to connect the dots properly. And it may not happen on the first day. It may not happen on the first day. It may take some time. But with experience, you will understand and gain confidence that, okay, connecting these dots will be the first step. You start treatment and then you will realize that, okay, it is working well, and then you will develop confidence that, okay, this dosha, I worked on this dosha, I gave this medicine, dosha pacified, symptoms subsided. When the symptoms subsided, you upashay, anupashay. Okay, you do something, there is subsiding of the symptoms, then you will develop confidence that, okay, my line of thinking is going in the proper direction. Okay, it may not happen on the first day, but what you are doing as a student, you are trying to understand and learn what are the diseases and what should be the ideal line of treatment, or how should it be planned ideally. Now we have a set of symptoms, we have a set of line of treatment, we have a set of complications which we are studying according to what is available in your place, whichever region you come from. I'm not even aware of your names properly, but wherever you are coming from, what is available there readily, what are the food items, what are the staples there, what are the herbs which are growing there, what are the local medicines being used there. See, you know a set of, say, Chinese medicine, Malay medicine, Thai medicine. I'm sure locally where you go, there would be people who have identified certain set of herbs, certain set of medicines which they may be using uh, as medicines. Okay, so they may not be really medicines as such uh, in terms of acceptability, but they know that when you do certain combination and you use it, the problem will subside. Understand and study that. So when you study it, you will know rasa, virya, vipak of those particular food items or herbs, and which can be used in alleviating a particular dosha. So if suppose a particular herb which is tikta rasa, okay, and has shitavirya, cold potency, you know that, okay, it is going to pacify pitta. Now wherever you see a condition where pitta gets aggravated and this kind of herb can be used there, you can try using it. It is not mentioned, say you have not seen it in your notes anywhere, the name of it is not mentioned, but because you know the properties of that, you can certainly try to utilize those properties in order to alleviate that particular dosha and see the results. So unless you try and study yourself, you may not be able to develop something of your own. Okay, so you are learning a particular pattern of treatment. I'm not saying you change the pattern. The pattern can be the same, but the kind of herbs, hence we say tikta rasa herbs, Ushnavirya herbs, Shitavirya herbs, or a particular Lavana foods or Amla rasa. Why we say that? Because when you come across such taste, such virya vipak of food item or medicine, you can try and utilize that on a smaller scale first as test, and then understand that okay, this is working well and this can be utilized in treating a particular problem. Okay, so we have discussed that in the past also, that not all the herbs, not all the medicines will be available everywhere. Okay, because of certain constraints and certain restrictions and certain rules, regulations. Hence, if you are able to define and develop something of your own, which is locally available, it will be more convincing, more easily, readily available, and you can define something of your own after understanding the line of treatment which has been described in the classical textbooks. And this is applied Ayurveda. Understand, this is applied Ayurveda. No disease. So, suppose if you are not able to identify, if you're not able to diagnose, if you're not able to define or label a particular problem, for example, Malavashtamba, constipation is there. Not necessary that it will have multiple signs and symptoms which the patient will tell. But if it is only constipation, do you need a label to treat a problem? Charaka Acharya says there is no need to define or label a disease by its name. If you know a set of problems, you treat the problems. The name of the disease is immaterial. You know the problems, you start treating the problems. Okay, so in case if it happens so that you are not able to judge, identify, or name a particular set of problems, you start treating the problems. As the problems subside, it is going to be sufficient for the patient to realize that it is working for me. The patient does not need to know if I am going through Vata Rakta or Amla Pitta or Am Vata or Rakta Pitta, whatever. What the patient knows, okay, I am going through a certain set of problems or a particular problem, and whatever medicines or treatment has been given to me is subsiding my problem sufficient. I don't need to know what is the name of the problem which I am going through. Patient doesn't need to know. Patient, the lookout of the patient coming to you is only to um, subside his or her problems. Okay, so I think I have spoken quite away from what our actual topic is, but as a clinician, these set of things are important for you to define your style, your pattern of treatment. Okay, so when we meet physically in Australia, that time we'll discuss more on, may not be this, but more on the other aspects which we are going to learn. But that time also I would understand what your intention of learning this is. Maybe we can discuss more on those aspects later. Fair. So exposure to heat should be avoided, and heavy exercises should be avoided in Vata Rakta, which we know that will aggravate Vata dosha and can aggravate the problems. So Hetu, Nidan Parivarjan, so staying away from the Hetus is equally important as the medicines or the treatment is. Okay, so with this,
Just one
we
question,
cover. Yes.
Doreen.
And how about damp weather, like humidity? Sorry, hot and humid countries.
Haha.
Will it aggravate the Vata Rakta?
Will it aggravate Vata Rakta? You are asking?
Yeah, I'm asking if humidity will be one of the causative factors.
Humidity, not so much. Humidity, not so much. It will, in fact, It will help not aggravating it. Because see, what is going to aggravate Vata and Rakta? Heat, exposure to intense heat, maybe it's sunlight or fire, and cold weather. Both these things are going to aggravate Vata Rakta. Humidity, not to that extent. It will keep it to where it is. It will not aggravate. Okay. Question answered?
Thank you.
Yes, thank you.
Okay. Okay. Fair. So we have covered Vata Rakta, and so what should be the next step, Hilary?
Oh, we'll have
Should
lunch.
we-
We'll have a break now for
Okay.
one
Okay.
hour.
Okay.
1 hour. So we'll see you back here in an hour.
Sure.
Thank you.
So that is 10:30 here.